Hello, and welcome to another episode of Caregiver College. Today, we're going to speak with Dr. Andrew Pickering, who's an assistant professor at the UAB School of Medicine. He's also the director of the Pickering Aging Lab and a scientist with the UAB Alzheimer's Disease Research Center. Today, we're going to talk about the causes of Alzheimer's and treatment options for the disease. Is there anything specific that causes Alzheimer's? I know we talked about changes in the brain. Does it have something to do with your environment, how much sleep you get, your stress levels?
So I'm sure, and thank you for asking me that. So I'm showing here a very complicated slide, and this is deliberately a very complicated slide. I do not expect you to understand what's going on here. This is a slide I took from a recent review on the disease. The point that I'm trying to make here is that Alzheimer's disease is quite a complex disease, and the more we study it, the more apparent how complex the disease is. There are multiple proteins and factors involved in driving pathogenesis and multiple things going on in the brain to cause the disease. So we see a number of changes in the brain with disease progression. We see a progressive shrinkage in brain volume. So I'm showing on this slide a slice of a healthy brain and a slice of a brain from an individual who had severe Alzheimer's disease. And you can see quite substantial shrinkage in brain volume. This shrinkage in brain volume is driven, at least in part, by a loss of neurons in certain regions of the brain. As well as a loss of neurons, we see a loss of connectivity between the neurons that are still present. So not only do we have fewer neurons, the neurons that are left are not as well connected as they used to be. We see a lot of abnormal networking occurring. We see a lot of connections forming that would not normally occur. We think that a lot of this is done to try to compensate for a lot of the loss that has occurred. We also, quite surprisingly, actually see hyperactivation in certain regions of the brain. So we see some neurons start firing really dramatically, which is almost as damaging as neurons not firing. So we see a lot of quite dramatic changes happening in the brain. So what actually causes this? There's two major proteins which we've identified as drivers of this. The first is a protein called beta amyloid, and the second is a protein called tau. Both of these have been linked with the disease pretty much from its first diagnosis. I'm showing here some very old historical drawings of the disease from when scientists were first investigating it. And when they looked at brain slices from patients with Alzheimer's disease, they noticed these sort of blob-like clusters between the neurons, which they termed amyloid plaques. They also noticed within the neurons these sort of tangly, whirly structures. The plaques were found to be made up of aggregated clusters of a protein called beta amyloid, and the tangle-like structures throughout the neurons was found to be made up of a protein called phosphorylated tau. Over the last 20 years or so, there has been vigorous debate. Maybe over the last 50 years, there's been vigorous debate about whether it's the amyloid or whether it's the tau that's causing the disease. And you'd have some researchers who were betas and some who were tauists. Nowadays, we've largely moved to a consensus, and the consensus is a bit of both. The general consensus today is that beta amyloid causes phospho-tau, and both of them drive Alzheimer's disease. The ApoE seems to be involved in the clearance of beta amyloid. And it seems that ApoE4 is not as good at removing beta amyloid as ApoE3. So if you have 2 copies of ApoE3 in your genome, then your nervous system is better at clearance of beta amyloid than if you have copies of ApoE4, which doesn't work so well at this clearance, which is why having more copies of ApoE4 increases your risk of developing Alzheimer's disease. What we think happens with tau is we think that beta amyloid causes tau to become phosphorylated. When tau becomes phosphorylated, it becomes prone to aggregate with other phosphorylated tau proteins to form these clumps called tangles. Interestingly, phosphorylated tau also has a propensity to phosphorylate non-phosphorylated tau. So you kind of get this vicious cycle where beta amyloid will cause some tau phosphorylation, and that phosphorylated tau will then phosphorylate more tau, and so on and so on. So we get more and more tau phosphorylated, more and more tau aggregated, less and less available tau to stabilize our microtubules, causing a progressive decline in neuronal structure.
Thank you. That was so informative. And for my next question, I just want to know, why is there no cure for Alzheimer's? And then what treatments are available? Are there medications you can take? Can you do brain training, or what are the recommendations?
Certainly. So as you mentioned, there presently is no cure for the disease, and there's a number of reasons for that. So if we look historically at clinical trials for Alzheimer's disease, between 2002 and 2012, there were 413 clinical trials for Alzheimer's disease drugs. During that time, during that 10-year period, only one of those 413 drugs reached FDA approval. So that's a pretty abysmal success rate. That represents a 0.4% success rate. If we compare that to cancer, typically in clinical trials for cancer drugs, we have around a 19% success rate. So why are we getting so much worse numbers for Alzheimer's disease drug development than we are for other diseases? There's a number of reasons for that. One is the brain is very hard to get to. That any drug that we want to develop to treat Alzheimer's disease needs to travel across the blood-brain barrier, and this adds a lot of restrictions to the sort of protein chemistry that we can use for our drugs. Another issue is we have a real shortage of volunteers for clinical trials. And most patients with Alzheimer's disease are over the age of 85. This is problematic from a clinical trial perspective. The ideal volunteer for a clinical trial is a young, mostly healthy individual. Most people over the age of 85 will take other medications. Perhaps they're taking medication for heart disease or for diabetes or for a wide range of other things. All of these other drugs that they're taking could have interaction effects, which can really complicate interpretation of the clinical trial. Mm-hmm. Another issue is we don't really have good measures for Alzheimer's disease progression. If we are doing a trial for a drug and we want to, and for us to work out if the drug is working, we need a good measure to show improvement. A lot of the behavioral measures that we use are a little bit subjective and highly variable, and make it very difficult for us to definitively tell whether the drug is really working or not. Another issue, as we talked about with the last question, Alzheimer's disease is a very complex disease. It involves multiple proteins, multiple pathways. Typically, from a drug development perspective, we go on the basis of one drug, one protein, one pathway. There's a debate about whether that's an appropriate strategy for Alzheimer's disease. My personal opinion is that when we hopefully get to more effective treatments, we're going to be looking at multi-drug strategies attacking multiple proteins and pathways. So with all that doom and gloom, what actual treatments are available? So right now, there are 6 FDA-approved Alzheimer's drugs, which I'm listed here. And I apologize, last night, I realized we were missing the last one, aducanumab, which was just approved last year. So I quickly added that. if this is something of interest to you, I would strongly recommend you to go to the website www.alz.org, which I'm showing on a slide. That website is an extremely helpful resource to provide information about Alzheimer's disease and therapies, and is a great starting point for you to do research on this topic. Most of the drugs presently available typically only work in some patients and are typically only effective when symptoms are at a fairly early stage in the disease at present. The drugs presently on the market typically can slow progression, but do not reverse progression. There's a little bit of debate about whether Ducomel may be more effective, though this is a very controversial topic. But with all of these drugs, they're most effective if started earlier on in the disease course. So if you or someone you know gets an Alzheimer's disease diagnosis, what can you do? Well, there's a number of things. The first item, I'd strongly encourage you to enroll in a clinical trial. This is extremely helpful to both to yourself and to the wider community. You help us develop more effective treatments for this disease. Additionally, you might get lucky. You may end up on a trial for something which is highly effective and can help you and your quality of life. Another thing, if you feel, and this is a shameless plug, but if you feel that Alzheimer's disease research is something that's important, then please let your congressman know. The best way in which we can develop better treatments for the disease is through more research on it. Other things, exercise, don't smoke, eat a healthy diet. All of these have been linked both with decreased risk for developing Alzheimer's disease and following diagnosis, slower progression. Plus, they try to get a healthy level of sleep. Disruption of circadian rhythm is a risk factor for developing Alzheimer's disease. Trying to maintain a healthy sleep cycle can decrease your risk of developing the disease and can decrease the rate of progression following diagnosis. Staying socially involved and cognitively active. There's very much a use it or lose it strategy, that if you continue to remain cognitively engaged, keep doing things that are cognitively challenging, you help to reinforce the importance of vital connections in your brain, which strengthens them against loss from the disease. That's all that I had on that topic.
Okay, well, thank you so much for speaking with us today and providing us all this information.
Thank you. It was a pleasure.